Good afternoon, everyone. It's my pleasure to welcome people back to the meeting. I hope they enjoyed lunch and they exchanged a couple of business cards and met a couple of new people that they may not have known before. And so it's my pleasure now to launch the opening plenaries. We have Rasu Shrestha, who's the Chief Innovation Officer from UPMC and Executive Vice President for UPMC Enterprises. Will tell us about UPMC Enterprises, followed by John Mayer, who is the Director of Research and Development for CTSI, and he will tell us about the fabulous work that he's done with the pinch competitions at the university. And then Karen Feinstein from the Jewish Healthcare Foundation will be telling us about some of the regional resources available. We have Bobby Zapala from Thrill Mill, who will also be speaking. But we had a last-minute substitution. Unfortunately, Rich Lunak wouldn't be able to, from Innovation Works, won't be able to make it today. But we're delighted to invite Larry Miller, who is the Life Sciences Executive in Residence at Innovation Works. So without further ado, Rasu.
Thank you. Thanks, Bruce. All right. How are you all doing? Excellent. This is quite the conference, and I'm delighted to be part of it. We're so happy that we're part of both sponsoring it as well as being part of the innovation community here in Pittsburgh. What I thought I'd do is spend a couple of minutes just talking about some of our reinvigorated efforts at UPMC around innovation and commercialization in the space of healthcare IT. And I titled my presentation "Life-Changing Innovation" for perhaps the right reasons. Absolutely, purple font too. But what's critical is in how we take all of the goodness of what we already have at UPMC and in the region here, and take all of these insights, the data, the great work that's going on across the community, and convert this to actionable insights. And companies that are successful, job growth that can really be remarkable for the region and beyond. So I'll talk a little bit about how we're doing it and the imperative for healthcare, imperative for innovation in healthcare. So I'll start with this. So this is all of us around the room and every one of us who have loved ones and friends across the board. The one thing that's in common across the board for every one of these individuals and every one of us across the board is really the fact that we all interact with healthcare. Whether we like it or not, we all interact with healthcare. And when we interact with healthcare, at least as it stands today, it's probably at the most vulnerable of times in our lives when we need to then navigate through this complexity that is the reality of healthcare as we know it today. The other thing that's in common across every one of these individuals and me and all of you in the room is also the fact that we all have our data that's locked away in silos of information systems that probably aren't talking to each other, probably navigating through all of the challenges of what's called interoperability amongst these silos of information systems. And so when a clinician, so I'm a radiologist by background, when a clinician needs to make a decision on a patient, on a protocol, on a therapy, we're more of a detective today than we are a clinician, because we're always piecing information together, and we're in these critical moments where patients, people, you, myself, we interact with healthcare, trusting in that entity on the other side to really make the best judgment, the best decisions that we absolutely can. We're dealing with essentially lots of these challenges around information systems that aren't really talking to each other. So whenever we see challenges, we see opportunities as well. And that's what I'm really here to talk about today. This is the Gartner Hype Cycle and the emerging technologies cycle, the graph of the Gartner Hype Cycle. And what's represented here is really technologies that are emerging, that are being utilized not just in healthcare, but in other industries as well. Right at the top of the peak of inflated expectations is the Internet of Things. So you'll see how connected devices and sensors are all coming together and spawning a lot of data, right? So how does that impact healthcare? You're starting to see things like consumer 3D printing coming down towards the trough of disillusionment. And then there's the slope of enlightenment with things like gesture control and enterprise 3D printing. We're seeing an emergence of gesture control being used in operating rooms, in sterile environments, and enterprise 3D printing now becoming real with specific prosthesis devices and others being printed out in 3D and being utilized in hospitals and battlefields across globally as well. So in my previous slide, I alluded to the hope that exists in healthcare today. There's a lot of hope. Whenever we interact with healthcare, whenever we go in and see our PCP or our oncologist, as it may be, we carry with us a lot of hope. There's also a lot of hype in healthcare, right? So how do we go from hope and hype to here? How do we make it real? How do we really ensure that as we talk about innovations in the space of healthcare, we strike home runs and we do the things that are most important for this person that's at the other end of this software or of the screen or of this company or of this investment? So one of the things that I'm a little concerned about is in healthcare we have a tradition of embracing complexity. This was a tweet chat that I participated in sometime recently this year, and we talked about this need for simplicity in healthcare. And I said in healthcare we tend to wrap ourselves in complexity like a warm blanket, and anytime someone tries to grab it away from you, you yank it back and like, no, I like my complexity, it must be better because it is complex. And I can tell you that is not the case, but that's essentially what we've been doing, at least in the last couple of years, decade, 2 decades, as we've been rolling out electronic medical record systems. We've really gone from analog to digital, but we've not let go of the complexity that comes along with it. So simplify is really important as we innovate in healthcare. Because here's what happens otherwise. So this came out in a publication fairly recently. It said the emergency department physician spends 44% of their time entering data into the EMR, the electronic medical record system, as opposed to interacting with the patient that's in front of him. So this is horrible. This is actually terrible. The electronic medical record system, and I'm not here on a rant against EMRs. I think EMRs have been superb because we now have all these zeros and ones, the data that I was talking about earlier. But at the same time, they're essentially today glorified billing and documentation systems. They're not really patient care systems. So how do we change all of that? How do we not spend 44% of our times entering data into the EMR? So what does the future hold for us as we gaze into the crystal ball, as we talk about all of the great innovations here across the Pittsburgh region and nationally as well as internationally? What does the future hold for us in healthcare? Because the times are trying. The healthcare reimbursements continue to decline, costs continue to escalate, complexity doesn't seem to be getting any better. So 2 big trends. One is healthcare reform. Right, so you've seen how healthcare reform, the trains left the station, and regardless of which side of the fence we are politically, overall, this is happening right now, and this, as a result of that, there are lots of repercussions that we have to deal with on a daily basis. A lot of them are really interesting. The other is consolidation. Right, you're seeing massive consolidation across healthcare today in provider organizations, the smaller hospital practices, consolidating with larger ones to gain efficiencies of scale, perhaps. Physician practices that are coalescing together, health plans, payer organizations that are coalescing together, companies that are merging together as well. So there's a lot of consolidation that's going on in healthcare. So when you see these 2 trends, there's consolidation and healthcare reform, we see opportunities, because with every one of these massive trends that's happening, there are specific challenges of data not talking to each other, these silos that are proliferating across the board, this need for volume to value. So we talk in healthcare today about the need for us to move from this volume-based practice of healthcare to more of a value-based practice of healthcare. It's not just how many beds you fill up or how many scans you do for this patient. We're zapping this patient with radiation. We've seen patients that have come to us with a suspect tumor or a lesion, perhaps in their chest, and we're zapping them with radiation. If the patient didn't have a tumor beforehand, well, chances are with all of that radiation, right? So there's a need for us to really define value and quantify value and incentivize value and build it into the inherent systems that we're innovating on. There's a need for us to move from an application-centric environment, which is what has proliferated in the last 10 to 20 years, to more of a patient-centric environment, right? So it's not just about the electronic medical record system or the lab information system or the picture archiving and communication system. It really is about the patient. So how do we do that? Because today, we're data-rich and information-poor, right? With lots of data, even at UPMC, we have upwards of about 5.8 petabytes worth of data that continues to double every 18 months, which is superb, because that's a lot of data. But how do we stay afloat in this ocean full of data? How do we put the data to work for us? How do we make sure that we're able to harness the power of the data and really do the things that we need to be doing for the patient that's at the other side? So we moved from that. So anyone remember this? The file rooms and the folder rooms of the yesteryears? To this, right? So we're now inundated with these windows and pop-ups, and there's alert fatigue amongst clinicians. So it's not necessarily a bad thing, like I said earlier, but it's just a step in the right direction. It is not the end of the road, right? So phase 1 was analog. Phase 2 which is where we are today. But phase 3 is what we really need to be shooting for. And this is getting interoperability right, making sure that we're able to connect the dots across all of these silos of information systems, as I alluded to earlier, really going from data to insights and making those insights actionable at the point of care or the point of decision making. And then looking at not just a patient at a time, but looking at populations of patients at a time, because what we're looking at are massive cohorts of data that actually can lend themselves into insights that we didn't have before. So back of the napkin explanation of this move from volume to value. Right? We are at the bottom of the pyramid as an industry across the board. We're data rich and information poor, as I mentioned, lots of silos of information systems. So the key here is, how do you go from data to information? How do you connect the dots across all of these silos and look at things like syntactic interoperability and what's called semantic data harmonization, looking at the meaning, the ontologies of ontology structures of both the structured and unstructured text, the labs, the allergies, the immunizations, the problems, the notes that you have behind these documents. And then go from data to information to knowledge, married with evidence-based guidelines, best practices, clinical protocols, perhaps the presenting symptoms of the patient that's in front of you when you look away from your EMR. And only then do you reach the pinnacle of the pyramid, which is wisdom, right? So that's our journey. That's where we're moving forward at UPMC and our approach to innovation. One specific example of this is the patient-centered medical home, which is something that we're pushing really hard for at UPMC through both our health plan and otherwise. And we have Dr. Kapoor here and other luminaries who are really part of this big movement around making sure that this data liquidity that I described earlier really puts the patient at the center of the care collaborative across the GI specialist and the PCP and the radiologist and the surgeon, so that we can look at things like care coordination and virtual care collaboration and really bring down unnecessary care and unnecessary cost escalation in the care delivery process, eliminating unnecessary utilization, really looking at more cost-effective ways to manage chronic diseases and others. So there is more data yet coming at us. It's not just from the EMRs. This is a Time magazine cover that is never offline, right? So how many of you wear some sort of a Fitbit type device? Exactly, almost the entirety of the room here. So, there's a lot of data that's hitting us across the board. There's also a lot of data that's coming at us through social media, which is one of the themes of the conference we're in today. This is actually a map of my social media network on Twitter, if you can believe it. And it's been nicely color-coded to show how I interact with industry, which is the dark green, patients, advocacy groups, media outlets, journalists, fortunately only 5%, which is nice. I'd like to keep it lower. Physicians, doctors, I interact with, I guess, 60% of my network are physicians, which is good, and hospital systems as well. So you can really analyze the data and get to the nuggets of the insights around, even just leveraging my Twitter network. But it's not about me, it's really about the patients, right, as I described earlier. We're seeing growing online conversations on a number of different issues across the board. This in particular is about breast cancer. So if you go to hashtag BCSM, breast cancer social media, you'll see just a lot of discussions that are going on online. Initially, it was led by the patients. Patients went online and coalesced and really talked about their treatment protocols and their experiences and what to do and what not to and where to go and where not to. And then physicians and hospitals started going online and saying, oh my goodness, they're talking online. We need to be where our patients are. Advocacy groups started going online. Pharmaceuticals started going online, right? So you're seeing this tremendous bump up. So if we could harness the power of that data, what would that look like, right? So therapeutic areas, advocacy groups, doctors, we're seeing all of these clusters of engagement that's happening online today. So it's not just the 20 minutes that you spend with your physician in your annual PCP exam that you have in your annual physical, if you do that anymore, right? It really is also about the 525,580 other minutes that happen the rest of the year in your life. This is from an ad that was in the New York Times fairly recently in 2015. And we subscribe to this notion at UPMC. If our hospital beds are filled, it means that we've failed. And this is reflective of some recent investments that we've been making through UPMC Enterprises that I'll talk about briefly as well. So healthcare, for the longest time, not just for the last couple of decades that we've been rolling out EMRs, but really for centuries, has been about curing illness. It's about curing polio, right? Not dying. And it's a noble pursuit, not dying. Yeah, sure, let's not die, it's good. But it shouldn't just be about disease, it should also be about living, right? And that's I think, a lot of what we're thinking about, but how do we make sure that we're innovating in this space and investing in this space and really moving the needle in the way that care is being transformed towards this notion. So innovation, at the end of the day, is not just about an application or a software package or a company that's successful. At the end of the day, it really is about behavior change. And again, behavior and behavioral science is one of the big themes of this conference here. So, and I truly believe this. So whether it's for the patient that's at the other end of that Fitbit device, or the clinician that's at the other end of that iPad or that EMR, for goodness, how do we make sure that we have the right behavioral changes in place to incentivize this actor, this individual at the other side, to make the right decisions at the right time, leveraging the power of the data? Technology has been everywhere today if you go into the hospitals, and it's not a bad thing. But I truly believe, I subscribe to the notion that technology really should be invisible, right? How do we just take technology away? It shouldn't be burdening. It shouldn't really task us with grabbing our attention. We should have a conversation with the patient. We should really be looking at the data and the insights that are in front of us. So how do we do this? So very quickly, the story of UPMC Enterprises, because it's really important for us to focus, right? And UPMC Enterprises, as much as it's a newer name and that you've heard of perhaps in the last year or 2 years, is not a new thing. At UPMC, over the last 2 decades or so, we've been doing a lot of things to focus around commercialization of specific technologies that we're developing at UPMC, focus on specific pain points that we're seeing on a day in, day out basis across our hospitals, across the payer organization that is UPMC's health plan. And we've had lots of lightning strikes, a handful of them at least, right? Stentor came out of UPMC, which is today the Philips PAC system that we still use here and globally is one of the leading PAC systems in the world. So a lot of folks look at these lightning strikes that we've had in the last 2 decades or so at UPMC and say, hey, Dr. Shrestha, those were, okay, those were what they were. They were lightning strikes. So we said, all right, how do we create a lightning factory? How do we make sure that we're able to create a discipline around taking some of these pain points, turning them around into innovations that are meaningful, not just for us at UPMC, but really from a commercial perspective globally as well. So hence was birthed at Bakery Square some years back, what we call the Technology Development Center. At UPMC for a while now, over a decade, we've had a commercialization effort through our International and Commercial Services Division. And about 2 years ago, we coalesced some of these efforts and really formed what we now call UPMC Enterprises. Also part of this is the Center for Connected Medicine, where we do a lot of thought leadership around where healthcare is and where it needs to be and how do you get from here to there. So UPMC Enterprises really is a coalition, a condensation of all of the good things that we've been doing over the last many years at UPMC. But it's also the tip of the spear for our investment appetite at UPMC, our commercialization appetite at UPMC. So our president of UPMC Enterprises, who also happens to be the treasurer of UPMC, Tal Heppenstall, Tal will tell you we're all of the above and none of the above. Right? We're a founder, we're a strategic buyer, we take companies public, we're a not-for-profit innovation fund, we're an accelerator and an incubator. But that's not all we're about, right? So it's not about the check that we sign, it's really about the hand-holding that we do to take the hope and the hype and make and convert it to the here, right? So how do we do this? With 4 specific focus areas that I thought I'll briefly walk you through so that you have a better understanding of how we focus in this space of innovation and commercialization. First and foremost is clinical tools. This is really leveraging data to drive better decision-making at the point of care. We have a number of efforts here in the space of imaging, in the space of clinical decision support, oncology, right, clinical care pathways, lots of things that we're doing in this space because this is the bread and butter of what UPMC has grown up to do well over the last many decades that we've been around. Population health is really become a buzzword today more than anything else. But our view to population health is that it really is in better managing risk, right? So from a payer and a payer-provider perspective, how do you more intelligently manage risk? Business services and infrastructure, this is really in squeezing waste out of the delivery of healthcare, because there is just so much waste in healthcare today. So whether it's back office functions like revenue cycle management or supply chain management, and then consumer. We pretend to understand the consumer in healthcare when we go live with a portal or 2 or 10, or we have an app in the App Store, but we really don't understand the consumer that well, right? So in this age of consumer engagement and consumer empowerment, how do we tap into that and really transform the way that healthcare is being delivered? I won't talk too much about the Pittsburgh Health Data Alliance. Dr. Bisich is here, and we've got many others that are part of this that will talk really about how we're leveraging the power of the data through this alliance between UPMC, Pitt, and CMU in transforming the way that healthcare is moving forward. The 4 domains are really cohesive cohorts that are coming together to work together in a synergistic way. They're not silos, because I think you got the drift. Against silos, I'm more of a bridge builder than anything else. Then we leverage the principles of human-centered design at Bakery Square. And we've grown from an organization that were essentially a couple of dozen people some years back. About a year and a half ago, about 100 FTEs. Today, we're over 200 full-time employees. So we've really grown rapidly. A lot of our individuals are engineers and human-centered design specialists and others. So we really work with industry and with researchers and with innovators and with clinicians to create the future of healthcare. Here are some success stories, some lightning strikes that we continue to foster. Evolent Health is one specific example where we worked, really this came out of the UPMC Health Plan, and in about 5 years this company went from just being a new startup to last year having an IPO event where it was valued at the time of IPO to about $1.2 billion. We've made some recent investments, even in the last few weeks, months, Lantern is one specific company that deals in the space of mental health. We believe that there's a lot of room for innovation in the space of mental health and taking stigma out of mental health and making mental health resources through CBT protocols directly accessible to patients and others. So we led a $17 million Series A for Lantern Health, and it's a San Francisco-based company that's now coming to Pittsburgh, working with us. So talk about reverse brain drain, right? So, and lots of other examples, including MedCPU, which was a much larger investment, a $35 million investment that we led, and we took a majority ownership stake in this Israeli company, and we'll be hiring about 20 engineers in Pittsburgh. So we're really trying to grow the region here as well. So, so that's what we do. We're an integrated delivery network. You know, going from hype to hope to here is not just a nice thing to have on a PowerPoint presentation. It's really what we're doing on a day in, day out basis. We give access to the integrated delivery payer provider system that we are, the data, the insights across the delivery of healthcare. We're a strategic investor. We put our money where our mouth is. We're a living lab, right? Make the mistakes here, perfect the product here before we then take it out to the industry at large. And we leverage the fact that we're partners in crime with Pitt and CMU and other really stellar institutions that we have here in the Pittsburgh area. And we're based out of Pittsburgh. This is ground zero for accountable care and value-based healthcare, which is remarkable if you think about it. So we're bridge builders. We need to continue to build bridges, right? That's why we're in Pittsburgh, perhaps. So, you know, going from hope and hype to here is really important, and hopefully, you know, we'll continue to make our contribution to that journey forward. With this, I'll pause here. It really is about fewer clicks and more moments. It's not about the technology per se. It's really about making a difference in the life of that patient at the other end. Thank you very much.